Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Klippel Feil syndrome, and we are looking at the conditions which are affected. So the conditions it includes, there is scoliosis. So the scoliosis, it is the most frequent orthopedic complication. And second, there is renal anomalies. And this is usually asymptomatic. It is usually asymptomatic. Next is some cardiovascular anomalies. And this includes the ventral septal defect, and this is the most common. This is nothing but the MC that is the most common. Then there is also the presence of the deafness, and the deafness is to obtain the audiometric testing. It's for the audiometric testing. Then there is also the respiratory anomalies. So these respiratory anomalies are basically the restrictions to the lung function. It is a restriction, and this will be to the lung functions. Lastly, there is a Sprengel deformity. The Sprengel deformity, it is the high placed scapula. It is a high placed scapula. It is a high placed scapula and it affects appearance and the shoulder motion. So it affects the appearance as well as the shoulder motion. To learn and grow daily like this, please do subscribe.